Hello and welcome to Community Service Spotlight. I'm your host, Bud Qualk, and today we're going to find out what NAMI is. So stay tuned, we'll be right back. And welcome back. Our hosts today are the Paducah NAMI President, Belinda Hudson, and the Paducah NAMI Treasurer, Jennifer Lewis. Thank you for coming today and being with us.
Thank you.
I'm sure the first thing our viewers would like to know is, what is NAMI?
NAMI stands for National Alliance on Mental Illness.
Okay, and what does NAMI do?
Well, it's this huge grassroots organization that's all over the country. There's 21 affiliates in Kentucky itself. And so we educate, advocate, and support for people with mental illness and for their families and loved ones.
Okay, and it's probably support is really important, because I know that, where do you go? You just don't go to the emergency room or whatever, right? So, and then you educate. Do you work with education with the what do they call them, clients or patients, or what? I don't know what the terminology even is.
Tell them about support.
We have a family support group, and that is for family members or friends who have someone with a mental illness. And we meet together on the same night as those who have an illness, and we.
What night is that? Is it?
We meet on every Thursday night, unless there's a holiday or something like that.
Not every third Thursday, but every night.
Every Thursday.
Every Thursday.
From 7 to 8:30, and we meet at St. Matthew Lutheran Church at 27th and Broadway.
Oh, right downtown.
Mm-hmm.
Well, almost right downtown.
We're really close.
Almost everybody knows where that's at. Yeah.
To the child care center, to the Baptist Child Care Center.
We're right across the
next
street.
door.
Mm-hmm.
Yeah.
Oh, so it's not the main church, it's the building. I know where it's at, the building right next door to it then. Okay, and that door is always on, what time did you say, 7 to?
7 to 8:30.
8:30, every Thursday. So if you are someone who is a victim of mental illness, or maybe a friend or a parent that wants to find out more,
Sure.
or a caregiver.
Right.
Okay. All right. Every Thursday.
Every Thursday. The fourth Thursday, we try to do something educational. We try to have a speaker. We've had everybody from our soon-to-be local politicians to the fellow that does Mr. Anderson. He's a guardian.
Yeah, who does guardianships.
Oh.
And we've had dietitians, and we've had
People from the bank.
and we've had psychiatrists, and we have something to offer.
Well, and I just thought of this, and I know we hadn't talked about this, but now I would love to come and talk sometime. I could talk about different things, but we'll talk about that after the show. And I know that's part of education. You have the educational people come in and talk and do all that. Before we go any further, and we'll hit this again at the end of the show, your contact information, your telephone number. Do you have an office? Maybe email?
Go ahead.
Well, we have an office. It's really our space to store stuff. It's not really functioning. I mean, we don't have hours. But our phone number there, it's just an unmanned telephone. So it leaves you a message, tell you where we meet. And our number is 270-443-3448.
3448. It's got a good ring to it. And say it one more time.
270-443-3448. 63448. I usually can sing the number better than I can say
It
it.
sounds like you're trying to sing it. That's why I made you say it again. Okay.
And we do have an email,
Okay.
and it's namipaducah@yahoo.com.
NAMI Paducah, all one word, and you spell NAMI N-A-M?
N-A-M-I.
Okay. NAMI Paducah at
Yahoo.com.
yahoo.com. Okay.
Yeah. See, NAMI's been around nationally for about 36 years, and it's been here in Paducah for over 30. But it's because it's grassroots, because it's just family members and people with mental illness who come together, the group expands and contracts, and so really the last 10 years or so, we've gotten more organized, and because of people like Belinda, we offer more services than ever before.
Okay, and we'll talk about volunteers later. You are two of the only paid employees, probably, right?
No, we
Nobody
have-
gets paid. Nobody gets
Okay,
paid.
I thought that was the case, but we'll talk about later how volunteers might get involved. Tell us about some of the educational programs you have. I know there was you had mentioned earlier to me before the show about a couple of NAMI Basic maybe or something.
NAMI Basics is one that we're trying to get started.
Oh, okay.
They have it in other places in Kentucky, but we have just had one of our members volunteer to take that training, to be able to teach it. And it is for parents of children who have a mental illness. And she needs somebody else to teach with her, but we're trying to get that one started. That's one that we have a great need for.
Okay.
And it's a lot like the program that Belinda teaches, which is called Family to Family. And tell them about that. It's-
Family to Family is a 12-week free course.
Free, I like that.
Free. And there is myself, and I have two other trained teachers, Barney McNeil and Amy Vagley, that are trained to help teach. And we meet one night a week, and for 12 weeks, and each week builds on the next. We cover things from brain biology, medications, how to handle things during a crisis, talk about self-care, and it's all free.
Well, that sounds, how many weeks you say?
It's 12.
It's kind of
was
like
gonna
a college night
That's-
class.
I was going to say, that's something, and some of the things you just mentioned,
Yeah.
so you really need some help teaching those
And-
classes, I bet.
And it's family teaching other family members. None of us are experts in chemistry and psychiatry, but we've lived through and we've experienced things that we share with other people.
And that's a NAMI signature course, same as this basics that we want to get here. And that means it's taught the same all over the country.
Right.
So our Family to Family is the same as it is in California.
Okay, so you have instructions and a format that
Right.
is okay. It's
Right.
not just made up as you go. It's structured. and-
Right.
Right.
Okay. Now,
And so the basics will follow along similar guidelines. And they have other programs too. There's In Our Own Voice, which is meant for people with mental illness to talk to other groups and explain to them what mental illness is like through their own story, when they first discovered it, what it was like before they got treatment, what treatment was like, and how they're doing now. So that's another program, but we have to have volunteers to do that. And they have, I'm trying to think. There's a veterans program too that we'd like to
Right.
get started here. And we've got interest from some teachers, but it hasn't reached the state of Kentucky yet, but it's in Illinois.
Right.
So we're trying to see if we can't.
That's called NAMI Homefront, and it's for veterans. And we have a couple of people who are veterans that are interested in helping out with that.
Well, I
Yeah.
have a number of veteran friends, and I have a couple that could use that, I'm sure. And they understand they could use that, you know, they,
Yeah.
but I bet sometimes, and this is a little bit off the cuff, but denial, you know, maybe some people know they have a problem, but a lot maybe be in denial, so
Yeah.
is it crisis intervention? Do you do anything like that, or?
Well, there is a crisis intervention training that NAMI does a small part of with police officers.
Right.
It's the Memphis model, and we got it here, let's see, in '07 or '08. And we meet once a year. It's going to be, what did I tell you, January 20? It's going to be second week of January here in Paducah.
And it's called CIT, Crisis Intervention Training.
And it's a
And-
40-hour
Training.
training for police officers in those initials that they use, CJOT or something. I mean, you know, it's like they're
they get credit for
certified.
that.
Yes,
Right.
they
And
get
they're-
credit
Right.
for
And
it.
it's
Continual
for-
education stuff.
Yeah.
It's for county, city, and state officers. And what that does is it gives them specialized training in how to handle a possible mental health crisis. And I think the goal, of course, safety first for them, but their goal is to keep people out of jail and to get them to help instead of going to jail.
Yeah.
I bet they run into that a lot.
They've had
policemen.
quite a bit of success from it too.
Yeah, the stories, sometimes you don't get stories. We meet quarterly, have an advisory council to work out any kinks that the police officers might be having with the hospitals or with the judges or with the jails or whatever. And sometimes you don't get stories. They go, well, we use this information every day now. You know, now that it helps them communicate better all the time. And this last time we met, we got at least 3 stories that were just fabulous. And you know that it wouldn't have happened, ended up as nicely as it ended up, had they not had that training and learned to communicate and to recognize and how to take it slow, you know.
No, I would. The average person wouldn't know any of that stuff. I know I wouldn't. You know, if I've met a person that was a criminal type person,
Oh, it
first thing I
doesn't
would
even-
think is arrest him and throw him in the clink. You know, or heck with him.
But a lot of times it's not a criminal type. It's someone who's acting bizarre, and everybody's afraid of them because they don't know how to approach them. So they get arrested for stupid stuff like, I don't know, criminal trespassing or just,
Yeah.
I don't know. But sometimes it's people who are suicidal too, and
Yeah,
They're trained how to de-escalate the situation.
yeah.
that's tough. You got to be an expert to do that. I wouldn't want to be the one to do that. De-escalate.
And that's part of also the training in the family to family and how to handle a crisis. We also teach how to kind of de-escalate things and to try to get things calmed down.
And you hear more and more about suicide by policemen. You know, they don't realize they really are wanting to shoot them. And I just saw one this morning where I think that's exactly what happened. They didn't come out and say it, but for
Yeah.
that person to, you know, just to draw the gun right on a policeman, just like, please shoot me. You know, it was something. Yeah. How about advocacy? Do you guys do any of that? Do
Oh,
you-
yes. As Jennifer mentioned earlier, we try to have some of our legislators come and speak at our meetings, and that's always interesting.
I'll bet.
Sometimes it's more eye-opening to them than it is to us. We go to Frankfurt. There's a NAMI Advocacy Day once a year, and we go to Frankfurt. It's a day set aside where we make appointments with our legislators, and you know, a group of us go and we sit down and we try to discuss what things
Any new legislation that's coming up this session that we
Yeah.
know about.
that would affect someone with mental illness or their family members.
And I think I had a paper over there. We had 4 things the last 2 years on our list, and they were things like putting more money into mental health,
Yes.
treatment for just community community mental health treatment. The mental health center has not had an increase in funds in over 15 years, and it's like beating our head together because you're trying to get the word out that it's okay to have a mental illness. It's like having diabetes or anything else, and then they can't find treatment because there's just not enough dollars to go to getting therapists and doctors. So we advocate for that. We advocate for putting less people in jail and more people into outpatient treatment. So we have some intensive outpatient programs that have just started here more recently for people with alcohol and substance abuse, because it's very common to have mental illness and abuse co-occurring together. So some of that is starting just since this Affordable Care Act has decided to pay for it. So that has been, we hope that's a plus, and we shall see. I mean, we already have some programs that have proven, but a whole lot more is needed.
Basically, what we advocate for is money, like
come on.
everybody else wants.
Yeah,
we
in the
want our
right
share of it.
fields. Yeah, that's right.
And mental health is something that carries stigma, and along with that comes ignorance. And because what most people think of when they think of mental illness is the worst scenarios that you see on TV, and the majority of people with mental illness are not a danger like that. And so to combat the stigma is something that we really advocate for.
Yeah, I mean, people with mental illness are more apt to run away or hide from a dangerous,
Or be a victim
Yeah.
of a crime.
because people will see someone with mental illness who might not be treated, and they are, like you said, a victim. They could be picked on. They could be
Taken advantage
taken
of, a lot
advantage of. Yeah.
Money is a big thing that they're taken advantage of.
Yeah. So less apt to be the bad guy than to be hurt by the bad guys.
Yeah. The two gentlemen I referred to earlier are the veterans that I know. That's what's happened to them. People take their money,
Sure.
and they don't realize they're taking it. They think, you know, buy this, buy that, I need 5, I need 10, and, you know, they just aren't real good with their money.
Yeah,
A
and
lot of
that's-
people aren't good with their money, I know.
Yeah.
But especially these two, I know, because they, before I could even help them, I ended up helping them, but by the time I got to them, they went through a lot of money.
Right.
People
And
taking
it would
advantage
be
of them.
good also if, you know, if we had funds to run programs that would be able to help people, kind of like a case manager, help them with their money, help them manage it, help them manage their doctor's appointments, help get them to places, you know.
Yeah, the VA has a program called a payee, a fiduciary payee, but a lot of times they don't know who to help with that. So once they do that, they get that money protected, but a lot of times the VA doesn't know who needs it and who doesn't. They don't see the bank records like I may see the bank records.
Right.
And see all the money just going out
Going
for
out.
stuff that doesn't mean anything. you know.
Right.
And it surprises me that you said that there hadn't been any really increases in mental health subsidies or whatever you call them.
Funding.
Because you see all the time about, you know, we have these horrific gun instances where people shoot the guns, and at least one group says, well, it's not the guns, it's mental illness, and we need to do more for mental illness, and we need to put more funds into mental illness. And I've heard that so much in the last 4 or 5 years, is need more money in the mental illness programs, and you don't see it, do you?
And two, when you hear that there have been budget cuts, where do they cut? They cut in education, and they cut in
Some social
Programs
programs.
like
Yeah.
that.
We've had legislators in Kentucky that are wonderful, and one of them is Jimmy Lee, and I think he's retiring next session, at the end of the session, and he's been a big advocate for for different social programs. But maybe money well, when you see these things on TV and we tell them mental illness, well, I think that's still scary for people who want to donate. A lot of it nationally, which is another area we advocate, just not in the state, locally, but also nationally. And you know, the National Institute of Mental Health, there's research arms that need to get the funding, because we'd like to identify those genes. We'd like to find that vaccine if it's caused by virus. I mean, we want to. We think and we know that there's more help.
And I have a couple of other friends that are bipolar, and as long as they're on their medication, they're fine. It's just,
and the thing about the medication is it may take years to find the correct combination, because what works for you might not work for me. And sometimes it takes years, and that's really hard for somebody to endure in trying to get to that spot where they feel healthy.
yeah.
And then when they do, it does not help that every year you have an insurance company that goes, you have to do step therapy. We're not going to pay for that. Well,
Right.
that's just
Fail first.
fail first. Yes, that really is craziness. I mean, you got somebody who's actually stable, and you want them to become unstable just because it's going to save a couple of dollars. Let's not do that.
Yeah.
These people might not recover from that. I mean,
Yeah.
it's that's a hurtful policy, and I'm sure it's hurtful if you've got heart disease or if you've got mental illness. But the fail first policies are something else we'd like to advocate for. Don't do that.
Yeah. Well, I know with my experience, if you don't have we talked about the advocacy thing again, is you don't have a good, and I forgot the term now, lobby. If you don't have a good lobbyist, the only thing that gets done in Washington or even Kentucky is stuff that has a lobbyist. If you don't have a lobbyist, it's almost impossible.
Yes.
I don't know if mental illness has a big lobbyist
Well,
or...
Sheila Schuster,
And Mr. Lee.
and yes, he's a
Wow.
legislator, and she's really a lobbyist, but she's the lobbyist for a whole consortium of illnesses.
501c3s,
Yes.
501c3s.
From children to developmental disabilities to mental illness. So she does a lot of disabilities in
So
general.
she's stretched thin.
In just general, yeah.
yeah,
Now, you do have a national headquarters,
sure do. In Virginia.
Virginia?
Don't ask
Not
me
the
to
University
say
of Virginia, I hope.
Oh, I've got it written down here somewhere.
Yeah.
Okay.
We've never been there.
We've
but
never been there. Since I've been with NAMI, they've changed locations at least twice.
Okay.
And they've changed websites, formats 3 times. So every time you go on it, you have to figure out how to navigate it.
Hopefully for
But,
the good.
Arlington,
it is.
Virginia. It's
Thank
in
you.
Arlington today.
Today. And
That's where the big
but the
VA
website
cemetery
does
is.
have a lot of useful information, the national website. And so you can go in there and you can look up the mental illness that you're looking for, be it schizophrenia or bipolar or PTSD or borderline personality, and it'll talk to you about that. And there's blog spots you can go to.
And that's
there's
at NAMI.org.
NAMI.org.
That's the
NAMI.org.
national.
I
The
didn't
national.
think we had mentioned that yet.
Right, that's the
NAMI.org.
national.
NAMI.org.
NAMI.org. And
NAMI.org.
then NAMI can,
NAMI
they've changed it.
KY Advocacy.
NAMI KY Advocacy is
Okay.
the Kentucky. But if you go to NAMI.org, you can plug in your state and get
It
that.
sends you right to NAMI, Kentucky.
Okay, what is your goal? Before we're getting close on time, but I wanted to cover that. You've got goals that you have to meet for headquarters, or just personal goals, or
Well, basically our goal is to advocate and educate and support to get the word out that about mental illness, that it's an illness like any other. It's a brain disorder.
It's not a personal failing. It is not bad parenting. It is an illness.
It's 1 in 4 adults experience mental illness with any given year. And that's separate from children. And
It's not a personality trait that's bad, it
No.
is an illness.
I mean,
Yeah.
if you told me you had cancer, you know, I would be very comforting, and there's a whole host of support for that, and research and education. But when you say mental illness, people take a step back
Yeah.
because it's scary, it's unknown. A lot of it is
Yeah.
unknown.
And most people know people that are suffering from this. It touches almost everybody. I'm sure it
Exactly.
does touch everybody.
Well, 1 in 4, there's 5 of us in the studio right now, so.
One of us is
You know.
I've got problems, so I'm not going to talk about them, though.
You know, and NAMI supports people with all different kinds of, I mean, we have a whole host of differences there. We have people who live with depression, who live with obsessive compulsive disorder, OCD. There's bipolar,
Yeah.
all kinds.
Okay, well, we're getting closer and closer. If I want to be a volunteer, I'm sure you need volunteers. How would I become a volunteer?
Well, first, just come to one of our meetings or give us a call
At the Lutheran Church.
at the Lutheran Church on
2700
Thursdays. And
Broadway.
get to know us, let us get to know you a little bit, and we'll plug you in someplace. You know, if you've got a specialty, if you like to work on computers, if you're comfortable with that.
No.
Making phone calls,
If
you
you
know.
can organize, yes.
Organize, we need
If you
good
can go and hold
organizers.
somebody's hand while they do it, that would be good.
I'm good at delegating.
We'll take anybody, just about.
Okay.
Yeah.
And there's no NAMI membership. Is there a NAMI membership?
There is a NAMI membership. It's $35 for a household. If you are on a limited income, we give, there's an open door, which is $3, and that gives you access to national and state information.
Okay, as quickly as you can, contact information. Telephone number?
270-443-3448.
And the Lutheran Church every Thursday.
27th and Broadway in Paducah.
Okay, I want to thank you for coming in. It's really been interesting. I really learned a lot today.
Great.
Yeah. I want to thank our viewers for
Thank
tuning in
you.
also. And we'll see you next time. This is Community Service Spotlight. I'm your host, Bud Qualk. Thanks for watching.